Welcome back, knee enthusiasts. Ready for another deep dive?
Always.
Today, we're going to explore a case that'll make you rethink everything you thought you knew about knee pain.
Exciting.
I'm your host, Don.
And I'm Marge.
And we are going to dissect this medical mystery with all of you knee geeks out there.
All you knee nerds.
So you know me, I'm all about those intricate anatomical illustrations.
Yes, you are.
The way they capture those delicate structures of the knee.
Yeah.
But today's case really throws a wrench in the artistic vision of knee pain.
Sounds intriguing.
We're taking a cue from the International Journal of Surgery case reports, specifically a report published on November 13, 2024, about a 67-year-old woman experiencing severe knee pain. But here's the plot twist. The cause wasn't even in her knee.
What?
Turns out it was an incredibly rare type of hernia, an obturator hernia.
Wow.
So, Marge, could you break down what exactly an obturator hernia is for our listeners?
Sure. An obturator hernia happens when a portion of the intestine pokes through a hole in the pelvic floor, specifically a small passageway called the obturator canal. To help visualize this, imagine a drawstring bag, the kind you might use for gym clothes. The bag represents your abdomen. The drawstring is your obturator canal. And a piece of clothing poking out, that's your hernia.
Okay, I'm picturing it. But here's the million-dollar question. Why would a hernia down in the pelvis cause pain in the knee?
Well, it all comes down to our good friend, the obturator nerve. This nerve actually threads through the same obturator canal and is responsible for sensation in both the inner thigh and the knee. So when a hernia bulges through, it can pinch or compress this nerve. The brain then misinterprets those signals, making you feel pain in your knee, even though the actual problem lies elsewhere.
It's like a tricky anatomical puzzle. The case report mentioned that this woman also had rheumatoid arthritis, which makes it even more complex. I imagine that threw a wrench into the diagnostic process, right?
Absolutely. Rheumatoid arthritis, with its joint inflammation and pain, is a real master of disguise. It'd be easy to assume her knee pain was just another flare-up, especially since she didn't show any typical hernia symptoms.
It's a classic case of look beyond the obvious. They even did 2 x-rays of her knee. Did those show anything?
Nope, not a thing. The x-rays were completely normal.
Wow.
Which just goes to show that sometimes we need to dig deeper, especially when pain persists despite initial assessments. Speaking of digging deeper, this report mentioned a couple of clinical tests, the Hauschip-Romberg and Hannington-Kiff signs.
What are those all about?
Those tests are specifically designed to assess for obturator nerve involvement. Think of them as secret handshakes for doctors trying to uncover the sneaky hernia.
So what exactly do these secret handshakes involve?
The Hauschip-Romberg sign checks for pain or tingling in the hip, thigh, and knee when the hip is rotated outward or the leg extended. Imagine trying to put your ankle on your opposite knee, that kind of movement. As for the Hannington-Kiff sign, it involves checking for a specific reflex in the thigh.
So these tests help point towards the obturator nerve being involved, but they're not always present.
Exactly. That's what makes this diagnosis so challenging. You can't always rely on these signs alone.
Talk about a diagnostic puzzle.
Yeah.
So how did they ultimately crack the code and figure out it was an obturator hernia? What finally gave it away?
It took a CT scan of her abdomen and pelvis to reveal the culprit.
Ah.
That's when they discovered an incarcerated obturator hernia.
Incarcerated.
Meaning a portion of her intestine was trapped and couldn't move back into place.
Oh, wow.
Definitely not something you want to mess around with.
You're telling me incarcerated hernia, that sounds serious. So what happened next? Did they try to push it back in?
In this case, it called for emergency surgery.
Okay.
They performed a laparoscopic transabdominal preperitoneal repair.
What?
Or TAPP for short.
Okay.
It sounds intimidating, but it's actually a minimally invasive procedure.
Okay, so break that down for me.
Laparoscopic, imagine tiny incisions.
Okay.
A miniature camera. And instruments like something out of a sci-fi movie. They insert these instruments through the small incisions to get a clear view of the hernia and surrounding structures.
Okay.
Then they carefully push the trapped portion of the intestine back into place.
So they put everything back where it belongs. But what about that weakened spot in the pelvic floor? How do they prevent the hernia from recurring?
That's where the mesh comes in.
Okay.
They use a surgical mesh to reinforce the weakened area, kind of like patching a hole in a pair of jeans.
Right.
It provides extra support and helps prevent the hernia from popping back out again.
Mesh, the unsung hero of hernia repair. And the best part, this woman's knee pain completely disappeared after the surgery.
Exactly.
Talk about a case closed moment.
It really highlights the interconnectedness of the body and how sometimes the source of pain can be far from the actual site.
Yeah.
We often compartmentalize things.
Right.
Knee pain equals knee problem.
Yep.
But this case throws that out the window.
It reminds me of those complex anatomical charts we used to study.
Yes.
Everything neatly labeled and color-coded.
Uh-huh.
But in reality, the body is so much more intricate.
Right.
A masterpiece of interwoven systems and pathways.
Absolutely.
This whole discussion about referred pain really has me thinking,
Mm-hmm.
what other conditions can mimic knee pain, Marge? Are there other red herrings lurking out there that our listeners should be aware of?
You bet. Hip problems, for example, are notorious for masquerading as knee pain.
Okay.
Conditions like arthritis or a labral tear in the hip joint can refer pain down the leg, tricking you into thinking your knee is the culprit.
So it's all about tracing that pain pathway back to the source.
Yes,
What about nerve issues? Can those cause referred knee pain as well?
absolutely. Nerve impingement in the spine, like sciatica,
Oh, yeah.
can definitely radiate pain down the leg, sometimes even to the knee.
Interesting.
It all depends on which nerve root is affected.
It's a reminder that pain is a complex signal that can get misinterpreted along the way.
Ex-
It's not always a straightforward message from your body.
Right.
Sometimes it's a cryptic clue that requires some serious detective work to decipher.
For sure.
So what's the takeaway for our listeners? Should we all be worrying about hernias every time our knees ache?
Don't panic. Obturator hernias are still incredibly rare, especially those that present solely as knee pain.
Right.
But this case underscores the importance of listening to your body and advocating for yourself when something feels off.
Hmm.
If your knee pain is persistent, severe, or doesn't respond to typical treatments, it's crucial to discuss all possibilities with your doctor.
Don't dismiss those persistent aches and pains.
Right.
See your doctor, be specific about your symptoms, and don't be afraid to ask questions.
Exactly.
Early diagnosis is key, especially with hernias.
Right. Absolutely. The longer a hernia goes untreated, the higher the risk of serious complications.
You know, I'm curious about those clinical tests we discussed earlier. The Hauschip, Romberg, and Hannington-Kiff signs.
Yeah.
Are there any situations where those tests might be misleading or tricky to interpret?
That's a great question. As with any clinical test, there are limitations and factors that can influence the results.
Right.
For example, the Hauschip-Romberg sign relies on the patient's subjective experience of pain, which can vary greatly from person to person. Additionally, conditions like hip arthritis or muscle tightness can also cause pain, with hip rotation potentially mimicking a positive Hauschip-Romberg sign.
So it's about piecing together all the clues,
Right.
not just relying on one single test.
Exactly.
It's like solving a complex puzzle, considering the patient's history, physical exam findings, and imaging studies to arrive at the correct diagnosis.
That's right.
This case really underscores the importance of a thorough medical history and physical exam.
Absolutely. Taking the time to listen to the patient's story, understanding their individual circumstances, and performing a comprehensive exam is crucial for uncovering those subtle clues that can point us in the right direction.
You know, while we're on the topic of diagnostic challenges, I'm curious about your perspective as an orthopedic surgeon.
Yeah.
What are some of the other red flags that make you think twice when a patient presents with knee pain?
Well, there's several things that raise my antenna.
Oh,
First and foremost, any history of trauma,
yeah.
especially a significant injury like a fall or a car accident, warrants careful attention.
Okay.
We need to rule out fractures, ligament tears, or other structural damage.
Makes sense. So trauma is a big one. What else?
The location and nature of the pain are also crucial clues.
Okay.
Pain that's localized to a specific area, especially if it's accompanied by swelling, redness, or warmth, suggests a local problem within the knee joint itself.
Like arthritis or a meniscus tear.
Exactly. On the other hand, pain that's more diffuse, meaning it's spread out over a larger area, might suggest a more systemic issue or a problem originating from outside the knee joint.
So it's all about connecting the dots.
Exactly. And sometimes the dots lead us down unexpected paths, as we saw with our obturator hernia case.
I've got one more burning question for you.
Okay.
We talked about the laparoscopic repair earlier, but I'm curious about the recovery process. What's the typical timeline for getting back on your feet after this type of surgery?
That's a great question, and it's one that many patients are eager to know the answer to. Recovery from a laparoscopic hernia repair is generally much faster than traditional open surgery.
Okay.
Most patients go home the same day or the next day and can resume light activities within a few days.
So no marathon training right out of the gate.
Not quite.
Okay.
We encourage patients to gradually increase their activity level, avoiding heavy lifting or strenuous exercise for the first few weeks.
Makes sense. We need to give those tissues time to heal properly.
Exactly. And as always, we emphasize the importance of physical therapy to regain strength, flexibility, and range of motion.
Physical therapy, the cornerstone of recovery. Marge, this has been an incredibly insightful deep dive. What are your final thoughts for our listeners before we wrap things up?
It really drives home the message that knee pain isn't always a simple equation.
Right.
You know, it's not always as straightforward as knee pain equals knee problem.
Yeah.
Sometimes it's a signal from a completely different part of the body,
Right.
a message that requires us to think outside the joint, so to speak.
It's like those optical illusions where your brain tricks you into seeing something that's not really there.
Right.
Except in this case, it's your body playing tricks on you.
Yeah.
Sending pain signals from a hernia disguised as knee pain.
Exactly. And just like with those optical illusions,
Yeah.
it takes a trained eye, or in our case, a skilled physician,
Right.
to decipher the true nature of the problem.
So what's the takeaway for our knee-obsessed listeners out there? Should we all be on high alert for hidden hernias?
Let's not jump to conclusions.
Right.
Obturator hernias are still very rare. But this case does highlight the importance of being aware of the possibilities and advocating for ourselves when something just doesn't feel right. And if you have any of the risk factors we discussed earlier, advanced age, low body weight history of multiple pregnancies,
Okay.
it's worth mentioning the possibility of an obturator hernia to your doctor.
Okay.
They can then use their expertise and diagnostic tools to rule it out or confirm the diagnosis.
Early diagnosis is key, as we've emphasized throughout this episode.
Yes.
The sooner we catch these sneaky hernias, the better the outcome for the patient.
Couldn't agree more.
It's all about staying vigilant, listening to our bodies, and seeking medical attention when needed.
Absolutely.
Well, this has been another incredible deep dive into the fascinating world of knees,
It has.
even when the knee itself isn't the main character.
That's right.
I think our listeners will walk away from this episode with a newfound appreciation for the complexities of the human body and the importance of looking beyond the obvious. And that's a wrap for this episode, folks. Don't forget to like, subscribe, and hit that notification bell for more deep dives into the wonderful world of knees.
See you next time.
Until next time, stay curious, stay informed, and take care of those precious knees.